Hi, I'm Dr. Jason, and today I'll be talking about cervical cancer screening. In 2016, there were 259 deaths caused by cervical cancer. We now know that almost all the cases of cervical cancer are caused by a particular virus called HPV. We now have a test that can help detect HPV. It has replaced the old pap smear test and is now called the cervical screen test. In terms of the way the sample's taken, it's still the same, but it's now every 5 years because we found that it's just as safe in terms of this new technology for every 5 years. I highly recommend you do the test because it can help save your life.
Hi, I'm Dr. Sira. Today I'm gonna talk about cervical screening. So what happened is a lot of people always a bit scared to see a doctor. Actually, it's very simple and short procedure, and it's just a little bit uncomfortable, not as painful as many people think. And nowadays, in Australia, we recommend ladies, the age between 25 to 70 years old to have the cervical screening. And now, the good news is it's every 5 years instead every 2 years, like what, Dr. Jason explained earlier. Let me explain a bit more about cervical screening. So let's have a look here. So this is the, female organs. So this part is the vagina, which is the opening, that goes through the cervix here. So what we do is we take the little smear, the sample, a little bit from this, cervix area. And the cervix is actually the end of the uterus or the womb of the lady. What happens is, if you come to this area, what we usually use is actually very, very small speculum. And usually, we use a gel as well to make you feel comfortable. So it's not that, painful or, like many people think. And then what happens is, we use this brush to just, brush a little bit at the cervix to get the sample and then put into this, little bottle and then send it off for the test. Let me show you how it works, with the test. So what happens is, I usually, ask the lady to lie down on the bed, and then, we put actually the small little instrument through the vagina, and then we open up a little bit like that to see the cervix. So once the cervix is visualized, we then take the brush to actually go through this space, to this speculum, and then take a little bit of smear out. And then the speculum come out. It takes usually less than 1 minute to finish the whole process. So it is very simple and easy procedure, and like I say, it doesn't cause pain or anything much like that. It's just a little bit uncomfortable, and it's very short period of time. Usually it takes about 1 or 2 weeks to get the result back. So usually I recommend all the patients to come back for the result so we can make sure that we put the reminder for 5 years time. Because 5 years is long, it's very easy to forget about the next cervical screening. And if you have any problem down below, for example, bleeding, spotting, painful, or anything like that, if you're not sure, talk to your doctor and we can actually do the cervical screening earlier than 5 years time. So if you have any questions about cervical screening, talk to your doctor and make sure that you have a regular cervical screening done.
If you would like to know more about cancer screening, please see us at the reception to book an appointment.